Hello, Senator Lee. My name is Thea. I'm an NSA, National Association of Social Workers California intern from UC Berkeley, and I'm a constituent in your district. So I just wanted to let you know, or wanted just to expand a little bit on what social workers do and who we are. We have to go through a rigorous master's program at the end where we get a master's degree, an MSW, and we work in a variety of different settings, private, in schools, in prisons, in child welfare, and our code of ethics bonds us to social justice and social policies. Thank you so much for meeting with us. We're here on our lobby day appointment, and I'll let my team introduce themselves. So Jen.
Hi, my name is Jen. I'm an MSW student from Sacramento State University.
Nice to meet you.
Andrew.
Hello, my name is Andrew. I'm also a Master's of Social Work student at San Jose State University.
Great. Nice.
And last but not least, Maddie. Oh, sorry, Erica. Maddie.
Hi, my name is Madison Bootkoff. I live in your district, and I am a Master of Social Work student nearing graduation from Sacramento State. Thanks for your time today.
Great. Nice to meet all of you. Nice to see all these young people in a master's program. It's really inspiring.
So we'd like to introduce 3 bills that we are supporting for our Lobby Days event. So to introduce the first bill, I will go ahead and give the floor to Andrew.
Thank you, Thea. Hello, Senator. I'd like to bring up a crucial bill that would positively reform just the way our criminal system operates, which is AB 256, also named the California Racial Justice Act for All, of course, introduced by Assemblymember Ash Kalra. To fully understand this bill, AB 256, we kind of have to first reference AB 2542, which was passed last year. That bill, AB 2542, prohibits the state from seeking or obtaining criminal conviction or imposing a sentence based on race, ethnicity, or national origin. Last year, that bill gave individuals a chance to file a motion to vacate a conviction or a sentence by demonstrating that a judge, an attorney, a law enforcement officer, witness, or juror may have exhibited bias or animosity towards the defendant because of the defendant's race, ethnicity, or national origin. However, while this bill passed last year was a landmark effort, it is prospective only, and effective solutions to combating systemic racism in this state should not only focus on preventing systemic harm, but also repair the harm that marginalized communities face. So this is where AB 256 will make an immense impact. It is a retroactive bill, meaning that we can affect and kind of right all the wrongs and repair some of the harms that have been done previously. So prohibiting racism in our courts and providing a person a means to remedy racial bias is the right thing to do. And because it is, it's also the right thing to do just for everyone. So those with prior convictions and sentences deserve equal justice under the law and have waited very long for this opportunity. This bill has received tremendous amount of attention in the media, also support from various community grassroots agencies and national recognized organizations such as ACLU, Ella Baker Center for Human Rights, and League of Women Voters. For these reasons, NASW California could not have a more firm, strong stance in this bill. We strongly urge your support on this piece of legislation. Can we count on you as well?
Great. I mean, that sounds really interesting. And I think I voted for it last year. I think I voted for the original Kalra bill. I think it might be a little hard to prove bias, but I don't know if you have any thoughts about that.
Yes, and very good question, Senator. What we've noticed is that, well, I guess the positives to that question is that with 2542 last year receiving bipartisan support from both parties up and down, We know that that bill was just pioneered and truly a landmark piece of legislation. And this 256 would just extend on some of those provisions. So rather than just making it prospective, we would do it retroactively and ensure that some of those same provisions from 2542 just get accounted for folks who have already have convictions and sentences.
Okay. And do you know if this has it been voted on, or when is it going to come before me?
This bill is currently sitting in the Committee for Appropriations. So it has been introduced and has gone through its initial phases.
Okay. Thank you.
Thank you.
Thank you, Andrew. So the next person to introduce our bill is going to be Jennifer. Are we going to go by Jen or Jennifer?
Jen.
Jen, okay.
Good afternoon. Hi, thank you so much. So I'm here today to talk about Assembly Bill 1400, which is about instituting single payer healthcare and really eliminating profit from our healthcare system. Copays, premiums, really taking the whole profit part of it out of our system because of, as the COVID pandemic has underlined, our current system of healthcare doesn't work. So AB 1400, which was authored by CALRA, of course, is also known as the California Guaranteed Healthcare for All Act, or CalCare. And it would guarantee comprehensive, high-quality healthcare to all California residents as a human right. The establishment of the CalCare program is an improved Medicare for all type healthcare system. Despite the gains made under the Affordable Care Act, nearly 3 million Californians have no health insurance, while millions have insurance that they cannot afford to use because their copays and deductibles are too high. Meanwhile, for-profit insurance companies are reporting record-breaking profits, even while the COVID-19 pandemic continues to ravage California and medical bankruptcies are at an all-time high. Sponsored by the California Nurses Association and authored by Assemblymember CALRA, AB 1400 will ensure that all Californians, regardless of employment, income, immigration status, race, gender, or any other considerations, can get the healthcare they need free at the point of service. So the bill has numerous co-authors, joint authors. It's building a lot of momentum. There's lots of grassroots momentum from the Nurses Association that the nurses have generated. And we do believe that there will, enough momentum is being generated that it will culminate in the bill being able to pass.
Right. I mean, it's a tough threshold to cross. I know that I've been interested in single payer healthcare for a long time, but not all of my colleagues. So I hope, the grassroots action we're seeing this year could really make that happen. So thank you.
We're also thinking that the COVID-19 pandemic will
Mhm.
also act to move things along in this way.
Okay, great. Thank you.
And we are really so grateful because Andrew is going to tell us a personal story about why single payer healthcare is so important.
Sure. The single payer healthcare and just affordable healthcare in general is a topic that's not new to any of us, I'm sure. But last year I had very much personal experiences with this. My father was diagnosed with stage 4 lung cancer at the beginning of January in 2020, and going through just hospital visits or his hospital stay, medication, treatment, everything that involved in that. The number one, as everyone would attest to, it's incredibly expensive receiving those medical bills, bills that we still have not paid off, bills that we don't foresee it being paid off anytime soon. So not only is it expensive, it's also for a normal person like myself or my father to be able to navigate the processes of what medical billing looks like. So on one hand, it's a bill coming from the hospital. On the other hand, it's a bill coming straight from the doctor. It's the hospital is an in coverage hospital, but the doctor who comes into my room is an out of network doctor. Therefore, I get a separate bill with an out of network cost, even though it's an in network hospital. There's just far too many things that is impossible for the average person to navigate. A single payer healthcare system that would just alleviate a lot of those problems, reduce some of the headache and financial burden on my family and other families across the state. So, strongly urge your support in this one as well.
Okay, I'm really sorry to hear about what your family has gone through and their struggle. I think most of us could relate to that. Most of us have had somebody in our family that has had a very expensive surgery or condition, and the best to you.
Oh, and lastly, thank you again for your time. Really, we would like to present our last bill that we're supporting, and Madison will be describing it.
Yes, thank you, Thea. I will be discussing AB 71. As I'm sure, Senator, you're well aware, California has been and is experiencing a homelessness crisis. Ironically, California's economy is one of the largest in the nation, and we have the highest rate of residents experiencing homelessness. There have been a few funded solutions to the crisis, like Project Room Key and Project Home Key, and those have been impactful, but they have also faced obstacles that have limited their success and limited their capacity to serve the vast numbers of Californians needing housing. The crisis requires more than one-time investments. It requires a comprehensive and sustainable response. Lack of funding and accountability has prohibited California from really taking on this issue. The AB 71 will provide a sustainable solution to the homelessness crisis by revising federal tax law to hold California corporations accountable for paying taxes instead of avoiding them in low or no tax foreign countries. That would provide state funding for long-term solutions to homelessness. The state would distribute those funds to local governments, allowing them to use best practices to meet their community's needs. AB 71 would also hold the local governments accountable for how they use that money. It would also seek funding through the 2021-2022 budgeting process. High housing costs that have outpaced residents' earnings have led to over 100,000 Californians, including children. It has led to over 100,000 Californians, including children, becoming homeless and thousands at risk of becoming homeless. Despite the recent attempts to solve the issue, between 2018 and 2019, the homelessness rate increased by approximately 17%. And researchers expect a higher increase due to the pandemic. Additionally, the current measures do not account for racial and ethnic disparities. Minorities, especially African Americans, disproportionately experience homelessness. While 6.5% of Californians are African Americans, they account for nearly 40% of Californians experiencing homelessness. And there are likely much higher rates of homeless youth for which we have not accounted. The homelessness crisis in California is only getting worse, and AB 71 offers a long-term framework for solving it. Social workers are bound by a code of ethics, which includes helping people in need and challenging social injustice. AB 71 would help accomplish this by providing what local governments need to meet their community's housing needs. For these reasons, NASW California strongly supports AB 71. Can we count on your support?
Well, homelessness is such a pervasive issue. In my district, it has gotten so much worse. We see people under all our bridges, and it's like it's never been before, and I think it's gotten worse with the pandemic. I do feel like the governor has been very concerned, and he has given a lot of money to homelessness programs. So why is this different?
So he has, but those are one-time solutions. They're short-term, and this is a long-term solution.
Okay, great. Well, yeah, I do want to do anything, to help combat the homeless issue. It seems like you all took on some really big issues at your lobby days this year, but I do have another meeting. So I will have to go, but I really appreciate talking to each and every one of you today.
Thank you
Thank
so
you so
much,
much for
Senator
your time.
Lee. We're so grateful for the opportunity to speak with you today.
Okay, thank you. Bye-bye.
Thank you.
Recording.